In yesterday, we did discuss about some platelets, right? So, what are the function of platelets? Anyone? কাকে বলবো কাকে বলবো কাকে বলবো তুই বল বল function of platelet. From where platelet derived? From where platelet derived? By, huh? Yes? জোরে বল, লজ্জা পর কিছু নেই, তুই যেমন জানিস না অনেকেই জানে না। Platelet are derived from megakaryocyte, from bone marrow. So if we want to know the platelet count, what to test? I'm basically going through a very severe back pain due to some vertebral problems is happening, because already I have a spinal surgery. Anyway, so to know the count of platelet, what to do? CBC, that means blood. Can we do bone marrow to detect the platelet? No, because from the bone marrow it comes into the bloodstream as a fragmented particles of the megakaryocyte, and that is called the platelets. And platelets is a shape of very tiny biconvex. That. Now question is that the cell membrane is coming from, this platelet cell membrane coming from the megakaryocytes. The organelles, that is the Golgi body, everything, mitochondria, everything is present as except nucleus is not present. Different granules were described in the previous class, and two receptors already mentioned, and that is your homework for to know, to discuss the other receptors. Anyone? Yes. Yes. Wait. GP1A, 1A. Okay. GP1B. P2. Okay. Sit down, because it is no more explanatory. Now, this GP1B all are present in the platelet membranes, right? So GP1B receptor is for the coagulation process, like adhesions. I'm coming later. So nowadays it's called, that is GP1B10W na. GP9 and GP5 also present in the platelet membrane. So GP1B does not roaming around. So if free, so this complex that helps for the platelet adhesions. Now what about the platelet adhesion? It is need for the hemostasis. Hemostasis means hemo means what? Blood. Stasis means it was homework for the previous name. So now new name is like that. 2B3A is present, is written, it is also written in your book. But remember, nowadays it is called integrin alpha 2B beta 3, and GP1B called GP1B95 or 59 complex. Now the third one. Now this third one, like that. P But in the between, two receptors are off, two receptor এর নাম নেই, only 12 receptors are there. তাহলে এখানে 12টা, এখানে 13টা, 14টা রিসেপ্টর আছে। Now between these 14 দরকার, two receptors are important for us clinically also as well as pharmacology. ওই যে লেখা আছে 1 to 14, তাহলে 1 2 3 4 5 6 করে 14 আছে, বাট মাঝের কোনো একটা দুটো নেই, দ্যাট ইজ আননোন। বোঝা যাচ্ছে? তো দিস রিসেপ্টার্স আর ভেরি মাচ ইম্পর্টেন্ট ফর ইচ অ্যান্ড এভরি স্টেপস অফ hemostasis. That is important for our clinical aspect also, because we know the drugs which are used oftenly in case of to prevent the cardiac heart attack, ischemic strokes are like that aspirin, clopidogrel. So these receptors are the inhibitors of that drug, inhibits these receptors. Anyway, but from now to remember this receptor also present in the platelet. তাহলে কি কি রিসেপ্টরস হলো? GP1B95 কমপ্লেক্স, ইন্টিগ্রিন, আলফা, 2B, বিটা 3, আর যদি ভুলেও যাস 2B3A মনে রাখ। 2B3A মোটামুটি 99.99% ফিজিশিয়ানস নো, 99.99 তুই জিজ্ঞেস করবি, আমি একদম কনফার্ম। Not known to maximum of this, because day to day practice যারা করছে তারা বই খোলে না। Anyway, the name has been changed totally and the new name is intriguing. Now there GP2B3A or intriguin alpha 2B beta 3 and then P2Y12 মানে 12 and 1. আমি এটা 12 বলছি, এটাকে 1 বলছি। These are the receptors mainly important for our purpose of the hemostasis, right? Now, hemostasis means hem and stasis, that means we are now is need of any clotting factors? Need of any clotting factors? Yes, definitely we need. It depends upon the type of injury or strength of or big of our injury. If it is small, because in your lab, in your hematology lab, we are always pricking, আজকেও হবে, pricking your finger, right? So this is temporary plaque formations. Now what are the steps for the hemostasis? Now what are the steps? Remember, for all throughout your life, vasospasm or vaso, এই চকগুলো কি রে, আমি তো লিখতেই পারছি না। টেম্পোরারি সবথেকে ভালো হচ্ছে টেম্পোরারি প্লেটলেট ফরমেশনস। Primary hemostasis. But what happens in case of, explain why it is called primary. Second is coagulation. কি আছে তার আগে? clot retraction. Fibrinolysis. Restoration functions. কেন এগুলো পরপর আসবো? It will take time. If I want to, if it's time permits, I will finish. Points, 6 points, 4 points you can, but never miss three things. One is vasospasm, another is temporary platelet plaque formations, and third one is coagulation cascade. Coagulation cascade means it needs some clotting factors, right? Clotting factors গুলোর নাম মনে রাখবি। নাম মনে রাখা বলতে পুরোপুরি নাম কেউ জিজ্ঞেস করে না সাধারণত এক্সামে। Only the factor name, that is a 12, 11, 9, 5, everything is there. So vasospasm, vasoconstriction, temporary plaque formation, secondary. Now my question is that which type of patients you may think that may be some problem of platelet problem, or maybe such problem of primary plaque formations problem, or some patients may having some coagulation cascade problem. So there is some symptoms must be there. So you have to think about that. What are those patients may come with different types of symptoms? What are those? Suppose the purpura, petechial rash, purpura, means nasal bleeding, hemostasis, vomiting a সময় blood. These are the terms you will know day to day. Patient number two, patient knee joint pain, not able to walk, 13 years, swelling bilaterally, and these are the features. So what is the difference? এখানে কোন রকম কোন পেটিচিয়াল র্যাশ বা কোন রকম কোন এপিস্ট্যাক্সিস গাম ব্লিডিং নেই। That means I want to emphasize the two types of bleedings are happening here. Number one is one patient is having some cutaneous bleeding and mucosal bleeding. Number one. Number two is second type of patients having some bleeding in the deep muscle or inside the bone or nearby bone. That means deep bleeding is happening. There is no cutaneous and mucous bleeding. What do you mean by mucosal bleeding? Epistaxis is a mucosal bleeding. Gum bleeding is a mucosal bleeding. Hemostasis is a mucosal bleeding. What do you mean by cutaneous bleeding? Purpuric rash, petechial rash. These are the patients. So two types of patients are there. Now you have to think having a patient having some knee joint swelling and is unable to walk, and you are seeing that inside there is a blood. If you impinge a needle, then these patients will come in knee joint as a blood. That means in the joint there is a blood collections are there. Minor trauma may cause bleeding. So that means the coagulation cascade problem is there, not for the temporary plaque formation problem is there. The problem in case of this one, that is the secondary hemostasis or coagulation cascade problem in case of these patients. And in case of these patients, they are severely compromised platelet count or maybe functions. Now count is called thrombocytosis. Means thrombocyte count is less. Now thrombocytopenia means functional loss. Thrombocytopenia means functional platelet or dysfunctional platelet or less function of the platelet. So to work the function, it must be কি খাচ্ছো মা তুমি? হ্যাঁ বল। What are you eating now in the class? কি বলছে? অ্যাপেল। Why are you hitting here? Why are you hitting here? Come to the first bench in there. Come and sit down. In my class is a very much disciplined, otherwise you can't leave my class. No problem to me. No problem. I can take class with one student only. I can take class. So please maintain your decorums, maintain you will be a good doctor, hopefully. So now it must be disciplined. Okay? So two types of patients I am giving to you. One is sitting in the OPD 1 and one is OPD 2. Some sorts of OPD 1 patients having some cutaneous bleeding, that is some rashes are there, petechial rashes are there, nose bleeding are there, gum bleeding are there. Always suspect about the platelet. We don't suspect about that. That may happen, may both. But first of all, first instance, as an intern, as a medical officer, we have to detect, we have to check the platelet count. For the platelet count checking, must be peripheral blood smear is the ideal. Peripheral blood smear is the ideal to know the platelet count, not only the CBC or etc. CBC teo jara platelet count, that is not automated. Platelet count is there, but reliable, most reliable is a peripheral blood smear. That is essential for many reasons. Anyway, so these two types of patients you will get. You will get during your internship, you get your day-to-day practice. If you're going to be a child specialist, then oftenly we got into these patients. So in case of these patients, like 13 years old male patients, knee joint pain, swelling, not able to walk, and blood inside the joint means mostly the hemophilia, right? So hemophilia is mainly the male dominant, and so this is a X-linked, and these patients may have many things that may be ITP, that is immune thrombocytopenic purpura, or any other viral illnesses may cause such type of platelet count less. Now my concern is that when critically important platelet count less, we will be more cautious. If it is less than 1, suppose some too much worried? No. Then which count may you alert about the patients? That is the less than 50,000. Any patient's platelet count is less than 50,000, that means high alert. As well as if any patient platelet count is 7.5 lakhs, more than 7.5 lakhs. I am giving my example 2 days back, that means Ajki ba Sommar. Thursday. I came across a patient having fever for last 8 days. Now my decorum is that if any patients come more than 5 days of fever, in this scenario, must go for the CBC first. The key hoyeche dekha jak. Dengue, fengu sab test kore niye esche. When I go for the CBC, then the reports was 8.5 lakhs of the platelet count. That is starting point. What is happening now? So if any patients more than 7.5 lakhs, something is there, you have to check for it. So that patients are 8 days old, 8 days of fever, high fever, and highly able child, age is only the 3.5 years. So in our scenario or in our day-to-day practice, if any patients more than 8 days fever, irritable, thrombocytosis is happening, that means most likely is any cause of vasculitis is happening inside his body. One of the important vasculitis is our Kawasaki disease. Don't remember the term. I am giving my experience only. What is the importance of the platelet, etc. That means Kawasaki disease. The Kawasaki disease as an atypical variety was there, and it was done by confirmed by the echocardiography, like by getting the coronary aneurysm. মানে হার্টের vessels গুলো ফুলে গেছে. And immunoglobulin is a drug of choice. Now he is almost cured. After giving the injection of immunoglobulin, fever gone, patient irritability gone, platelet count goes down, everything is magic. So platelet count, my concern is that 7.5 lakhs more than 7.5 lakhs platelet count, always be alert. Always be alert. And less than 50,000, any platelet count is also alert. Alarming sound. In case of dengue, 1.9 a 1.5 to 1.1 lakh, 90,000, 70,000, not a matter of joke if it is still within the range of 50,000. If it is 50,000 or less, alert. Alert for the, what is the LFT count is going on, down and down and down platelet count means your LFT count will be altered and that may patient come into the dengue shock syndrome. That is a catastrophe of a dengue. That's why I am a dengue bhai. So everything is a planned and your knowledge and information. If knowledge and information is correct and you are applying your knowledge correctly, you will be never be disappointed and your great teaching is your patient. Okay, it's a great teacher of your patients. Now two types of patients and two types of bleedings are happening. One is type of is a cutaneous and mucosal bleeding and another is a deep bleeding, muscle bleeding. একটা বড় মাসল নিয়ে ব্যথা দিয়ে চলে এসেছে দেখা গেল it is happening in the bleeding in the muscle. That is also coagulation cascade problem. That is not temporary plaque formation problem. That is not due to the problem of primary hemostasis at all. It is a problem of secondary hemostasis. So primary hemostasis means temporary plaque formations. Secondary hemostasis means coagulation cascade. When need coagulation cascade, if temporary platelet count or temporary platelet plaque formation is enough for the stoppage of bleeding, then why we need the coagulation cascade? Because of our injury. Temporary, the name itself same, that is a temporary. If it is temporary, that means unstable plaque formation is there. For more bleeding, for aptitude, একটা ছুরি দিয়ে তুই হয়তো দিছিস কেটে আর একটা পিন পিক করেছি, দুটোর মধ্যে তফাৎ আছে। Okay, so if it is pin prick, then temporary plaque formation is enough for the stoppage of bleeding. But in case of your knife cut, then it must be some coagulation cascade. So before any operation in your surgery, in your this, always CBC, platelet count, bleeding time, clotting time is important. In the bleeding time is directly proportional to the platelet count. And clotting time is directly proportional to the coagulation cascade pathway. If any patient is having bleeding time is high, that means platelet count is low. And if any patient is clotting time or coagulation time high, that means what? That means coagulation cascade problem is there. Maybe some deficiency of some clotting factors. That may be some liver problem also, because you know already some factors are synthesis in the liver. So any patients having some cirrhosis of liver or liver disease or chronic liver disease, always we go for these tests, as well as we do PT-INR, just namta general, and Pratham in time INR. These are the important for the coagulation cascade, and these are the important for any liver disease also. These are the important for any surgery. Before anesthetic checkup, anesthetic asks you to do this. Why? Because if any patient is having bleeding count high or clotting time high, that means the surgeon cannot maintain their hemostasis properly during the surgery. Bleeding loss will be much more. Hypovolemic shock cannot be decompensated, and then causes the catastrophic death due to the hypovolemia. Blood diyo kichu korte parbe na. If we don't know the pattern of this, if we know that the patient having some problem, then we have to arrange accordingly what is happening and what to be done. Structures are there to know better understanding for the most. So it is now for your clear observations that platelet coagulation cascade is directly important for your clinical practice, right? It is directly important. Platelet counts so much important is that you know already. Some of you maybe suffer from dengue fever. We always see the two things, that is the platelet count and also the PCV, that means paxil volume. That is due to the thinking that there may be the leakage of blood inside that. Platelet count kome geche, platelet count is less than 30,000, 40,000, 10,000. If it is less than 10,000, mostly intracranial bleeding is pre-epiting. Any time can happen. Intracranial bleeding and death. Intracranial bleeding means hemorrhage in brain, and that may cause death. Less than 20,000 is a precipitating factor for the intracranial bleeding. Less than 10,000, obvious intracranial bleeding must be there, except in case of ITP. In case of ITP, that is immunothrombocytopenic purpura, if it is happen also the 10,000, I have seen many patients with ITP with the 15,000 count, 10,000 count, they never ever be, at least in my experience till 15 years, that never a patient can bleed intracranially in case of ITP patient, because this is the immune mediated. There is the immune mediated, and so that we transfuse, if I do the transfuse the platelet, it does not happen, it will go down again and again. So in case of ITP patient, platelet transfusion is your information's problem, your knowledgeable problem is happening. But still, if it is catastrophically patients having some other problem means other coagulative problem, you can transfuse the platelet of these patients. So anyway, remember that in case of ITP patient also, platelet count less than 20,000, it's not so much risk if we treat acutely. Acute ITP happens in children, and chronic ITP is present mostly in the adults. So these treatments are those that the steroids and immunoglobulin to immune mediated destruction of the platelet can be prevented. Anyways, it is beyond your scope to discuss the ITP, but still for this in your mind that we don't only know the hemostasis steps, but why you should know, that is important for your this class. Suppose this is a blood vessel, this is a blood vessels are there. So these things are there. Now, below these endothelial cells, what are those? Collagen. And below that, smooth muscles. These are smooth muscle cells, etc. So now this is the very clear to you. If any cut injury or any pinprick injury, you are pricking this way, right, to damage the endothelium, to exposing your collagen, as well as some smooth muscles are there. So in the smooth muscle, two types of receptors nearby is there. One is surface of the smooth muscle, the one is the surface of smooth muscle, or another receptors are there. Another receptors are there, nociceptors. Nociceptors means what? আমি পিন পিক করলাম, আমার পেন হলো, কেন হলো? So these receptors are stimulated. কিভাবে হলো? Any injury or anything you are entering into foreign body that invites inflammations. Inflammation means some cytokines can come. কে এনে একদিনকে জিজ্ঞেস করছিল cytokines কি, chemokines কি? Cytokines means after the pro-inflammatory, after the inflammatory process, cytokines will come. That may be different types of cytokines, interleukins, leukotrienes, chemokines, all of the cytokines presented there is due to the pinprick. এখানে দিয়ে pinprick করেছিস তুই, এখানে দিয়ে পিন পিস করে, যেটা তুই হাতে আজকে করবি, অলরেডি হেমাটোলজি ক্লাস বোধহয় আছে, করতে হবে। So this is happening due to the inflammations and cytokine release. These cytokines initiates the accents or pain. That is, the nociceptors are presented there, and nociceptor reflex are there for this pain. Now, the point was what? There is a vasospasm or vasoconstrictions. Before that, I want to know from you how our blood is in fluid state. Which factors are help anyone others? Which factors helps us to keep our blood fluidy thin? নয় তো জমতেই থাকছো, ও বলবে বেশ, একজন বল। Okay, number one. Then? Good. Number three? No, that is a fibrin. That is not the issue of fibrin. Fibrin is formed after the fibrinogen is converted into fibrin also. That is not the issue. Then third one, দেখ ও কিন্তু পড়াশোনা করছে, পড়াশোনা করলে কোনো ব্যাপারই না, টু গেট পাস তো ছেড়ে দেই। ইয়েস, sit down. So he is doing his explanatory is excellent. This is the endothelium cells. There also the blood vessels. In the blood vessel there are some important factors like right to also কি থাকবে, different proteins are there, fibrinogens are there, bond eleven factors are there, protein C is there. So all are the formation from the liver, all are present in the blood. My question is that if this platelet can stick into here, then we cannot form in the fluid state. So some factors are there to keep our blood fluidy or thin. Well, number one is a nitric oxide and PGI2 also called procycline. These two chemicals are also within this NO is a vasodilator. And PGI2 and both it inhibits the platelets for the inactivations. Platelet inactivations. তাহলে platelet কে বলছে ভাই তুমি যেও না, এখন platelet formation প্লাগ তৈরি করতে হবে না, because there is no injury. তোমাকে ইনজুরি নেই যখন তুমি চুপচাপ এখানে বয়ে বেড়াও, তোমাকে কিছু বদমাইশি করার দরকার নেই. If you do that, then the blood of our normal body will be thicker, and then this problem of this anginal pain, embolus will go, fibrin mass work will go into the heart and small coronary vessels of heart, and that can block, and that may cause the heart attack also, myocardial infarction also. So to keep it this way, number one. Number two, he already told that the surface is some molecules or receptors or molecule, that is heparin sulfate. Heparin connected is now what does this antithrombin 3 does? My question is that it is like a cutter, it is like a blade which is cutting the three factors mainly, factor 2, factor 9, factor 10 as well as 12, 2, 9, 10, 11. So 12, 11 no, not written in any journal or any good books. It's to some extent written in 12. So in this very few books are written that 12, but 2, 9, 10 is enough to cut. What are those? These are the clotting factors, right? If we deactivate this, there is no question of clotting. That means we are keeping our blood in fluid state. Number 3, that is a one important point, is a thrombomodulin. Suppose here it is thrombomodulin. And this is thrombin. Now thrombin, you know, already you know that thrombin means coagulation help করে, তাই তো thrombin. Thrombin forms fibrinogen to fibrin, causing the helping. But thrombomodulin, the name suggests that modulate the function of thrombin. Modulate the function of thrombin. So modulation of the function of thrombin means inactivated protein C is present already in our blood flow. Protein C. With this type of modulated thrombin connected to the thrombomodulin, এটাকে কি বলে? the inactivated protein C. Now what to do? Yes, so this inhibits inactivates. So what is happening here? It happens in two ways. Number one is causing the vasodilation as well as is causing the inhibition of the platelet. Antithrombin and the heparin sulfate complex causing the factors 2, 9, 10, 12 destructions or cutting of the functions, and the thrombomodulin thrombin complex modulates the function of thrombin. Protein C is become activated from the inactivate state, and that inactivates the factor 5 and 8. Simple. So that's why keeping our blood in fluid state, তুই আমি এখনো ক্লাসে বসে আছি, for this reason is happening. But this is normal body. Damage here. If we damage here, এখানে damage করে দিলাম. So we need a platelet plug formations for the temporary passage, to stop the temporary passage of blood loss as well. Now these are the collagen, that is the কি বলে এটাকে collagen fibers, subendothelial collagen fibers, and these are the exposed. Now these are the receptors are there, that is called 1 alpha, that is called 1 alpha in the collagen, and another substance released from the damaged endothelium, that is von Willebrand factor. Not only that, this von Willebrand factor present in the blood itself. Von Willebrand factor is flowing also. Not only that, only released from the endothelial cell, but it also present in the von Willebrand factor in the normal blood. Von Willebrand factor are stored in the cone granules, alpha na beta. Alpha, that is stored, not the formation, like that fibrinogen, not synthesis here, it is stored. Fibrinogen itself present in the blood. Fibrinogen is produced by it is the protein, so liver. So these things are happening and present normal blood. So von Willebrand factor, now it will come down, there is a von Willebrand factor to the exposed, and this is the receptor for the 1 alpha. If you remember or forget, then the von Willebrand factor connections with these receptors of the collagen, there is a 1 alpha. Then that, remember that complex I just already told you, that is GP1B95 complex. It helps for the platelet adhesion after the injury of the endothelium. So what are the steps for the platelet plug formations? One is platelet adhesion, then platelet activation, then platelet aggregations. So these things are important. Nowadays some researchers going on that activation aage hoy and aggregation aage hoy. This is happening. Whatever it may be some same time, or maybe little bit one before, one after. Each and every step is important. So now these platelets will come with which receptor? 1B95 complex, or the sub bhule ja shudu 1B. So this will come and bind with that, with this receptor of 1B, GP1B. So now only platelets are there. Now this is not inactivating by the NO and prostacyclin. That is not inactivated because the damage of the endothelium is there. NO and prostacyclins are released from the healthy endothelium. So the level of these substances are less, inactivating the platelet. So this is now very much active, and then come to the von Willebrand factor connections. There is von Willebrand factors. Through this von Willebrand factor, it connections with the collagen fibers. So that is called platelet adhesion. Adhesion to what? Adhesion to the collagen fibers. Now একটা platelet এলে হবে না. That means some activation must be there. Before activation, shape of the platelet changed. some blebs will form. These blebs are helpful for the release some of the granules. তাহলে কি হলো, adhesion first হলো, then shape of the platelet changed. এইখানে আছে যে পারে, আবার এটা লাগার পরেও চেঞ্জ হতে পারে, মানে অ্যাডেশনের আগেও প্লেটলেট ব্লেবস হতে পারে বা অ্যাডেশনের পরে ব্লেবস ফর্মেশন হতে পারে। এটাকে বলা হয় প্লেটলেট ব্লেবস অর সিউডোপোডস। ইজ বেটার ইউ ক্যান সে the platelets pods or pseudopods are pattern for the activation further. If it is activated, then it release, কি রিলিজ করবে? calcium, serotonin, thrombocytopenia. Now my question is that what is the function of ADP? ADP functions কি বল? How? Now the receptor will come, those two receptors, that is a P2Y12 and P2Y1. Now what is happening? Those two receptors present in the platelet membrane. কি সেই দুটো? P2Y12, P2Y1 বলেছিলাম আমি, এই দুটো রিসেপ্টর নিয়ে আমি কাজকর্ম করব, and that is important. These two receptors এটা সব now for the platelet aggregation we need the activations or conformational change or expression of 2B3A or আরেকটা কি নাম আছে ইন্টিগ্রিন আলফা 2 বিটা beta 3, sorry, 2 beta 2 beta 3. Okay, these are এই রিসেপ্টরটা হচ্ছে, এখন সহজ করে দিলাম, জিপি 2B and 3A are helping for the aggregations. Aggregation means platelet to platelet connection, but this receptor is inactive. এ অ্যাক্টিভ নেই, এ অ্যাক্টিভ নয়। কখন অ্যাক্টিভ হবে? ADP will come to contact with those after the connection with this ADP with these receptors, these causing the conformational changes of this inactive receptor, and then only it will active. বোঝা গেল? তাহলে P2Y12 and P2Y1 function is that to connect with the ADP, and that is why it is called ADP dependent expression of the 2B3A glycoprotein. This is called ADP dependent. How? ADP is connected to these receptors, and these receptors are helps the conformational changes of this one, and only it is active. Whenever it is active, then it only aggregations happens. Similarly, another there is also a receptors like that. That is the receptors of key receptor. এখানেও তাদের P2Y আছে, alpha granules থেকে বেরোচ্ছে ADP, that is also helpful for the conformational change of the receptor. So this is according the platelet interaction aggregation. But how? This is in the middle, there is a fibrinogen, right? This is fibrinogen. এই স্ট্রাকচারটি মনে রাখতে হবে। If any in your theory paper is coming like that, you have to express like that. আমরা কি করি? ছবি দেখি। If your picture is correct, then you will give full marks. No problem at all to see the what you have written, what is written is wrong. No problem at all. If you leveling this receptor is the GP2B3A, activations occur. Firstly, the receptor is present in inactive state. By the help of ADP interaction with the P2Y12, এগুলো বুঝতে হবে বাবা, মেডিকেল সায়েন্সে, নইলে মুশকিল আছে, নইলে এখানে কানেকশনস হবে না। সো অল আর আওয়ার নিউরাল প্লাস্টিসিটি ডিপেন্ডস আপন দি লার্নিং। লার্নিং মানে কি, যখন পড়াবো যদি আমি স্কোপ পাই, লার্নিং অ্যান্ড মেমোরি, হাউ ক্যান ইউ লার্ন, লং টার্ম পোটেন্সিয়েশন ইজ হ্যাপেনিং, এগেন অ্যান্ড এগেন রিমাইন্ডিং অ্যান্ড রিডিং দ্য থিংস, অ্যান্ড দ্যাট উইল অ্যাকাস্টমস। এমনি এমনি আমি এগুলো বলতে পারছি না, এতবার দেখেছি, এতবার পড়েছি, তার কন্ত নেই। Okay, this is not like that a one night study. No, not at all. ভুলেও যায় মাঝে মাঝে। So in this case, repeated study is important to understand these things. I am very trying my best to simplify my ideas. Nothing else. It is not written in your book. It is not written in your book. Believe me, it is not written in your book which you are going day to day. But whenever you are reading, then it will come as a platelet aggregations, right? What does it mean? It means the interaction of platelet. How? It is interactions between the two receptors, that is GP2B3A. But you do know that these receptors are in first primarily it is inactive state. If it is inactive state or inactive, they must be activated before aggregation. For the activation, ADP will release after the pseudobot formation. Then ADP will come contact to those receptors, and this receptor helps for the conformational change. কি টার্ম বললাম? Conformational change. This is important. So change of what? Change of the receptor to activate. Now this receptor activate. This is also similarly activate of another platelet also. এটা তো এমন নয় যে একটা প্লেটলেট করছে। This is happening on each and every platelet. So these are coming down. Suppose এইখানেতে 8টা প্লেটলেট আছে, এইখানেতে 8টা প্লেটলেট আছে. That is also a receptor here. That is also a receptor like that. এখানে ওর receptor আছে। মাঝে fibrinogen is there. So what is happening here? Platelet to platelet interaction is happening. So this happening here. এবারে plug formation হচ্ছে. So platelets are coming and aggregation is coming, and in between these are called the temporary plug formation with fibrinogen. ঠিক বললাম? No. Fibrin কিন্তু আনিনি আমি এখনো। Fibrin is possible in case of primary hemostasis? No, because fibrin must be there if our coagulation cascade will come into play, then only fibrinogen is converted to fibrin. What is happening? Basically nothing. এটাই সব কাজ আমার করে দিয়েছে। This fibrin is break into the fibers into fibrin, and also cross-link. How I'm coming? Is cross-linking that, then these are the going to form like that is a meswork. Nothing else is a fibrin meswork is formations. This is my third point. Fourth point কি ছিল? Clot retractions and the repair. Clot retraction and repair. সেটা কি জিনিস? Clot retraction means happening here. Clot retraction means ছোট করে দেব. Then what will happen? Regenerations or healthy endothelial tissue must be there. মনে আছে বলেছিলাম platelet derived growth factor is released from the alpha granules, as well as vascular growth factor, vascular derived growth factor, platelet derived growth factor, as well as fibroblast derived growth factor or fibrous factor. These three growth factors are important for the synthesis of new endothelium, angiogenesis, new blood vessels, and blood collections, and the synthesis of some new cells. That means regenerations. কেন? এইটা যদি এখানে থেকে যায়, মনে কর রিপেয়ার হয়ে গেল, সব হয়ে গেল, if it is present, then that is a problem. Suppose এটা ক্লগ হয়ে বেরিয়ে গেল, then these golla will come into the heart and block the coronary aneurysm, brain aneurysm. A brain capillary is also blocked by this one. So that's why my fourth and fifth point was that fibrinolysis. Fibrinolysis means এগুলো কেটে আবার ঠিক করে দেবে. That is repaired. That is already repaired. Then now this is fibrinolysis. I will discuss everything. But keep in mind till now what is happening here. That is the primary plaque formations means platelet adhesion, platelet activation, platelet aggregations. For the adhesions, there must be damage of the endothelial cells, exposed of the subendothelial collagen fibers, and then non-delivered factor at 1B95 complex will come into play for the adhesions. After the adhesions, platelet structure changes into the pseudopods. The pseudopods will come and then activate to release the alpha granules. That is the dense granules from this. These will come the dense granules, the calcium, that is the ADP. Calcium, what is the role of calcium? The role of calcium is a contraction as well as calcium is an important member of the coagulation cascade, right? What is the role of serotonin? Serotonin directly acts on the smooth muscle for the contraction. What is the role of thromboxane? Thromboxane function duto. One is vasoconstrictions, another is a platelet aggregations. It helps with platelet aggregations. So each and every helpful. And what is the role of ADP? ADP binds to those receptors P2Y12 and P2Y1. These receptors changes the conformational changes of the 2B3A that causing the activations of the 2B3A, and then it forms into the platelet aggregations, one platelet to another platelet. This is important. It is oftenly asked in Viva. It is oftenly given in the written. This is platelet aggregations. What and how platelet aggregation occurs? Only 3 marks. So you have to write and draw. If you didn't draw, it's okay. Then I will read every and each line. If you draw this, I normally never see any lines. I see the picture. If it is correct, give him 3 to 3, full marks. No problem. So now this is the platelet plaque formations up to the fibrinogen is present. Right? Fibrinogen is present. You are pricking your finger. Fibrinogen contractions, aggregations, khatam. Platelet plaque formation done. Bleeding time. So what do you mean by bleeding time? Bleeding time correlates with these 3: adhesion, aggregations, and adhesion, activation, and aggregations. These are correlated with the bleeding time. So bleeding time is correlated with the platelet count, but clotting time is correlated with the clotting factors count, deficiency, function, etc. So that is big issue, because clotting time is much. Because clotting times means we have to face 2 pathways. One is intrinsic pathway, another is a extrinsic pathway. মুখস্থ করার দরকার নেই, আমি এমনভাবে বলে দেবো, অর্থাৎ যদি বোর্ডে করতে পারিস, it will remember for your whole life. So anyway, and this is the keep in mind in your list, P2Y receptor inhibitors are the clopidogrel. দেখবি তোদের অনেক বাবা ঠাকুরদারা খান অ্যাসপিরিন অ্যান্ড clopidogrel combinations. What are those? These are inhibitors of these receptors to inhibit the platelet aggregation, so that platelet aggregations করে যাতে clotting না করে, যাতে আমার atherosclerosis ওখানে হয়ে আছে, that is further not blocked by the any clotting or clot formations. So we prevent the clot formation. So long term aspirin, low dose, and clopidogrel. Clopidogrel is nothing but receptor P2Y12 inhibitors. Inhibit করবে কপি ক্লো পি আরো ড্রাগ আছে, আমি আর বললাম, not your time, it is for your pharmacology. But still, whenever you are going through your pharmacological second year, if you pass surely, so then only you can see those the drugs will come, and then you will remind this class. If you think sincerely, you have listened. Only 5 minutes left. Thank you. So these things are, but bigger, much more blood is coming, then we initiate the coagulation cascade. Just like Messi. What do we mean by Messi? He's a player, 10 number. 3 is there. 7. Sorry, 3, 7. Coagulation cascade is finished. Nothing to remember. So what is happening here? This is called intrinsic. That is called extrinsic. It is a common pathway. Now how to remember? Is a Heckman factor or it's a contact factor. If any contacts it is activated, then less than 1, 10 নেই, 10টা এখানে আছে। মেসি বড় মানুষ, এখানে চলে এসেছে আগে। He is a boss. So Messi is a boss. 9, 8, 10 and 3, 7. 3, 7 যদি প্লাস করা হয় 10 হবে। মাল্টিপ্লাই করা হয় 1 into 2 into 5 10 হবে। So this is forget করা যাবে না। এটা ভোলার কোনো উপায় নেই। So these are the intrinsic factor and this is the extrinsic factor. Question is throwing to you, if we are taking some blood and giving into the test tube, I am giving a story, better is give to a story. A patient come with me around 1 to 2 years back. Patient is coming with diarrhea, vomiting, abdominal pain, nothing else, without any fever, anything. So I thought this is a GI symptom or viral AGI, that time is happening. Suddenly I noticed that his eyes are drooling up. চোখের পাতাটা ফেলতে পারছে না. So I thought in some mind that some dehydration must be there, but still is some sorts of drowsy. It's not related to the dehydrations. So in my mind suspect that may be some snake bite. So I thought written that immediately blood test will be done. Blood test means what? Blood test means is a BT-CT, is a mainly the BT and CT, and that's why collections of blood is must. So in my clinics there is a lack of some syringes. So I enter the hospital, go to the hospital, I call this, but they refused. They thought they কিছু জানে না, কি সব বলছে, পেটে ব্যথা বমি নিয়ে না, বলছে সাপে ব্যথা, সাপে কামড়ানোর কোনো মার্কও নেই, there is no mark of snake bite at all. And then go to the, ও বোধহয় বাঁকুড়ার, ও ছিল বটজোড়া থেকে, তো যদি কেউ জানি, সরি, বেলিয়াতোর ইজ এ বাঁকুড়া ডিস্ট্রিক্ট, যদি কেউ থাকিস বাঁকুড়াতে তাহলে they all know. So বেলিয়াতোর থেকে ওরা চলে গেছে. Then suddenly from Health World Hospital, এই দুর্গাপুরে আছে, they called me from emergency that your patients have come at the 8 p.m. with shock and the salivations, gradual salivation and convulsion. And you have written already, sir, it is a query of snake bite, but they refuse to admit. তারা যায়নি. তাই I call it just backup দাও. It will is sent to the immediately PICU and start the antivenom without any fear. বলছে স্যার আমরা ব্লাড টেস্ট করে নিয়েছি অলরেডি, এটা কোয়াগুলেট করছে না. ব্লাড টানা মানে কি, আমি টানলাম, একটা টিউবে রেখে দিলাম, আমি এটাকে 5-10 মিনিট রেখে দেবো. কেন? 2 থেকে 7 মিনিট ব্লিডিং টাইম. নর্মাল ব্লিডিং টাইম ইজ 2 to 7 minutes. If it is more than 15 minutes and blood not clotting and the patient is like that, that must be some snake bite is there. Okay, why? Because the snake venom causing the bleeding disorders of coagulation, custard spoilage will lead to this. My question is that not like that. In that case, is my fellow friends asked, why you are thinking that? Because Kalaj is a snake which does not make any mark, but its presentation is a GI symptom. That was the clue to identify the snake bites. So snake bites, it's not its mark will be there. Any symptom may come. Only the drooling of eyeball, that means ptosis. You can understand after that. Ptosis may present is a snake bite, is a very early phase of the neurotoxic. Anyway, so this what I want to ask you, that whenever you are taking the blood, which system, which pathway is active for the coagulations? Because if I draw your blood and keep for 2 to 7 minutes, then it will coagulate. It will go, the serum will come and then coagulation will be done. It's okay, you are normal, not a snake bite patient. So which pathway, it is extrinsic or intrinsic? Anyone? Why? Why not your extrinsic? I mean, you are not extrinsic. Why? No, external. That is need to tissue factor. That leads to tissue factor. Tissue damage must be there. Will be written in the next class. Further, just remember in this way, the whatever I going to start from here in the next class. Okay. So remember, intrinsic factor is here. Intrinsic factors are activated for the coagulation in your tube, because the Hegman factor is only in contact factor. If any contacts, if you tube টাকে ভালো করে ধুলি তাহলে তো দিলে coagulate হবে. এটা আবিষ্কার কি করে হয়েছিল? যে one day we find that the clotting is coming on and clotting happening in outside. So the scientists thought that something is there. Yes, something is there. Okay, this blood is present. Then they thought that okay, ठीक है ये तो है ना किछु. Then someday a rat was going. Chelate the calcium chelate. There is no coagulation at all. Number one. So that non-coagulated blood is present, was present on with their record. Now a rat was going on and gone, then they kill him, and the brain tissue comes out. Some of the scientists thought some crazy, some that tissue fluid, মানে ব্রেনের টিস্যু ফ্লুইড বা টিস্যুটা নিয়ে ওই ব্লাডে যে সাইটেটেড ব্লাডে নিয়ে দিয়ে দিয়েছে, then that is the clog, that's the clotting starts, then that is the there is our discovery of our extrinsic pathway. So this something is there in the tissue that is happening, and it is the fast way. It only two factors are there, lots of factors are there in the fast way. So it is important clinically also, that is if you damage the extrinsic pathway, is a dangerous, much more bleeding must be there. But if you damage the any sorts of intrinsic factor, that is less time and less damage and less critical. Thank you very much. Dismiss my class. Thank you.
So you attended the class, right? You didn't attend. Okay, fine. Those who haven't attended, who are not able to attend the class, please listen. You will have a good idea. Okay, what? ठीक है, कोई प्रॉब्लम नहीं. सुनो, so last day I taught about ETC, the 4 complexes of ETC: complex 1, complex 2, complex 3, complex 4. I taught about redox pair. I taught about redox potential. I taught the definition of redox potential. I taught the names of complex 1 to complex 4. I taught how it occurs, yani ki how electrons are transferred from where to where? From complex 1 में क्या है? NADH. और complex 2 में succinate से, right? Very good. From complex 1 and complex 2 through coenzyme Q and iron sulfur complex, how it is transferred to complex 3, and from complex 3 through cytochrome A3, how the oxygen is the final acceptor of electron and how water is produced. And we learned the substrates for NADH and H+, and we learned the substrate for FADH, right? So now last day we discussed from the diagram. Should I draw it? I think I am continuing with the class. Before drawing, I am just waiting for the portable microphone. Okay. So before drawing, just go through your copies. Before drawing, I made you write the diagram of the inner mitochondrial membrane, and I explained how 12 kilocalorie of energy is produced and 4 protons are released from complex 1, right? Not towards me, towards your copy. See your copies, because I know you haven't read, and those who have read didn't remember. Okay, so 4 H+ ions are released where? In the intermembrane space. Okay. उसके बाद क्या होता है? complex 2 से कितना प्रोटॉन्स रिलीज होता है? 0. Very good. Because not enough energy is generated. complex 3 से कितना होता है? 4. And how much energy is consumed? 10 kilocalorie. उसके बाद complex 4 से भी only 2 protons are released. यानी कि टोटल कितना हुआ? शुरू से टोटल हुआ 10, राइट? तो ऐसे होते अब अभी now we already know that inner mitochondrial membrane is impermeable to protons, यानी कि जो बाहर चला गया दिल से निकल गया, ठीक है? सो अगर कोई दिल से घर में होता है ना, कोई बड़े बुजुर्ग किसी ने भाग के शादी कर लिया और दिल से निकाल दिया, होता है कि नहीं? तब पर घर में एंट्री करने के लिए कोई ना कोई पाथ तो रहता ही है, ठीक है? So similarly, there is also a space over here through which these protons can enter. But why do we need to know this thing? अभी देखो प्रोटॉन बाहर चला गया है, बाहर ज़्यादा प्लस 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 करके ऐसे प्रोटॉन ग्रेडियंट क्रिएट हो रहा है इंटरमेम्ब्रेन स्पेस में, और माइटोकॉन्ड्रिया के अंदर क्या हो रहा है? नेगेटिव ही नेगेटिव है, ठीक है? तो घर के अंदर जब नेगेटिविटी है तब पॉजिटिविटी को तो बाहर से कहीं से आना तो पड़ेगा ना, है ना? तो इन दैट सिनारियो what we need these protons to enter again into the mitochondria. Okay, यानी कि we have to balance it, but how will it come? Then उसके राइट साइड में एक ड्रॉ करना है, वो ड्रॉ कर दूंगा, डोंट वरी, ठीक है? तो वो आएगा कॉम्प्लेक्स 5 से, यानी कि क्या होगा? व्हाट इज द पर्पस ऑफ इलेक्ट्रॉन ट्रांसपोर्ट चेन? The purpose of electron transport chain is to generate ATP. ATP जनरेट करना है, ठीक है? अभी तक लेजी सा लग रहा था, अभी ठीक लग रहा है, ठीक है? तो ATP जनरेट करना है, तो ATP अगर जनरेट करना है तो क्या करना है कि वो बाहर जो प्रोटॉन ही प्रोटॉन हो गया है उसको अंदर लाना है, यानी कि देखो ये है इनर माइटोकॉन्ड्रियल मेम्ब्रेन, है? ये क्या था? This was complex 1, this was complex 2, this was diagram, right? And this was complex 4. वहां से कौन एक्सेप्ट किया था? हाफ O2 एक्सेप्ट किया था, और क्या हुआ था? वाटर हुआ था। बट अभी ये क्या हुआ था? 4 प्रोटॉन्स गया था। ये क्या हुआ था? 4 प्रोटॉन्स गया था। ये क्या हुआ था? 2 प्रोटॉन्स गया था। अभी तो ये तो होता रहता है ना, हो रहा है ना? तो बट ये तो फिर से लौट के आ नहीं पा रहा है, तो इधर नेगेटिव ही नेगेटिव है। अगर बहुत पॉजिटिव, बहुत ज्यादा पॉजिटिव ऐसा होता रहा तो क्या होगा? प्रोटॉन ग्रेडियंट होगा। अभी प्रोटॉन ग्रेडियंट को complex 5. So today, this is simple language, okay? So today, what we are trying to learn is chemiosmotic hypothesis. So this is a new term, write it down. So what we are trying to learn is chemiosmotic hypothesis. अभी chemiosmotic hypothesis क्या है सब बताऊंगा, पर पहले लिख लो। This machine is the world's, it's a turbine, okay? टर्बाइन जो घूमता है, वाटर से इलेक्ट्रिसिटी प्रोड्यूस होता है, वाटर को घुमाता है और दैट इज कन्वर्टेड इनटू इलेक्ट्रिसिटी। इधर भी वही है, ऊपर से प्रोटॉन ले रहा है, कुछ इनऑर्गेनिक फॉस्फेट एडीपी के साथ ऐड हो रहा है और एटीपी सिंथेसिस हो रहा है, ओके? सो इट एक्ट्स एज अ टर्बाइन and it is producing ATP, ठीक? तो here oxygen is consumed, as we can see from previous knowledge. So it is oxidative and inorganic, for just now I told you what inorganic phosphate is being utilized. तो नाम से ही पता चल रहा है ना, it is a oxidative phosphorylation. आया समझ में? पूरा लाइफ बायोकेमिस्ट्री में लगेगा ये टर्म, याद रखना, व्हाई इट इज कॉल्ड ऑक्सीडेटिव फॉस्फोराइलेशन। चलो, तो ये जो केमियोस्मोटिक हाइपोथेसिस है, तो इसी को बड़ा चौड़ा कर लेते हैं, इसको पोज देते हैं, ठीक है? तो सोच दिस इज आवर इनर माइटोकॉन्ड्रियल मेम्ब्रेन, ओके? सो अभी तुम ये सोचो, इधर H प्लस है, इधर H प्लस है, बहुत ठीक। दिस विल एक्ट एज अ टर्बाइन। टर्बाइन तो घूमता है ना, ब्लेड तो रहना चाहिए ना, हाँ या ना? ब्लेड तो रहना चाहिए। अभी ये ब्लेड्स को क्या बोला जाता है? These are called सब यूनिट्स, ठीक? अभी ये देखो, ये चीज जो मोटर है, इसका मोटर का 2 पार्ट होता है। ये जो सिलिंड्रिकल पार्ट मैंने ड्रॉ किया है, दिस इज द एफ F0 सब यूनिट, दिस इज द F0 सब यूनिट। और इसका और एक पार्ट है which is inside the mitochondria, ठीक है, which is F1 subunit, and this lamba portion is known as the gamma handle of the F1 subunit. This is known as the gamma handle of the F1 subunit. अभी इस गामा हैंडल के साथ अल्फा, बीटा एंड 3 डेल्टा सब यूनिट्स भी रहता है। ऐसे पूरा गोल करके रहता है, समझ में आ रहा है? 3D स्ट्रक्चर ऐसे गोल करके पूरा रहता है, 3 अल्फा, 3 बीटा एंड 3 डेल्टा सब यूनिट। ये जो मैंने कहा F0 सब यूनिट, 0 का मतलब है इट्स इनहिबिशन बाय प्रोटीएज। प्रोटीज छोड़ो, प्रोटीज याद मत रखो, कॉम्प्लिकेट हो जाएगा। ये लिखो इट्स इनहिबिशन बाय पॉलीमरेज, इट्स इनहिबिशन बाय पॉलीमरेज। और ये जो है, ये इसको बोला मैंने F1 सब यूनिट। F1, this one represent, it is the first factor which is isolated from mitochondria. This is intermembrane space, this is intermembrane space। बाहर है outer mitochondrial wall, outer mitochondrial membrane, this is inner mitochondrial membrane and this is inside mitochondria। ठीक है, अभी तक क्लियर है? अभी होता क्या है, मशीन तो देख लिया, अभी मशीन काम कैसे करता है देखो। ये देखो ऊपर यानी कि इसके अंदर ये जो 1 2 3 4 5 6 7 8 9 10 C F0 unit is composed of has 10 C subunits। ठीक है, लिख ले, F0 unit has 10 C subunits। अभी होता क्या है, टरबाइन क्या करता है, घूमता है ना, इट रोटेट्स ना। तो इसका मैकेनिज्म एक्शन समझ लेते हैं। ऊपर इसके बगल में लिख ले, ऊपर से नीचे आना, ठीक है। फॉर्मेशन ऑफ प्रोटॉन ग्रेडियंट एरो, फॉर्मेशन ऑफ प्रोटॉन ग्रेडियंट नीचे एरो, देयर इज रोटेशन ऑफ द F0 सब यूनिट, there is rotation of the F0 subunit, arrow, there is rotation of the gamma handle of the F1 subunit, there is rotation of the gamma handle of the F1 subunit, arrow, this brings about conformational change, this brings about conformational change in the beta subunit of F1, this brings about conformational change of the beta subunit in F1। अभी मेरे पीछे देख, अगर नहीं समझ पा रहे हो यही नॉर्मल है, मेरे पीछे देखो, ऊपर प्रोटॉन H प्लस देख रहे हो, वो कहां घुसा, F0 के अंदर घुसा। अब F0 के अंदर जो पॉकेट है दैट इज 10 C सब यूनिट, पूरा मिक्सर मशीन के तरह घूम रहा है ये, ठीक है। ATP इज बीइंग जनरेटेड, ठीक, और वो घूमेगा तो नीचे वाला पोर्शन देख F1 यूनिट, वो F1 सब यूनिट वो भी घूमेगा। अब F1 सब यूनिट का जो हैंडल है उसका नाम क्या है, गामा हैंडल, वो भी घूमेगा। और गामा हैंडल घूमेगा तो सबसे मेजर चेंज जो होगा वो है गामा हैंडल के आसपास देख 3 बीटा सब यूनिट लिखा है ना, वो बीटा सब यूनिट का कॉन्फॉर्मेशनल चेंजेस होगा, एंड दिस इज नोन एज बाइंडिंग चेंज मैकेनिज्म. This is known as binding change mechanism. This question is being asked. What is binding change mechanism? हो गया. अभी लिखो, what are the 3 conformations of beta subunit? What are the conformations of beta subunit? One is open. Open में क्या होता है? There is release of ATP. One is open. Open में क्या होता है? There is release of ATP. दूसरा है loose. दूसरा है loose. That is binding of ADP and PI. That is binding of ADP and PI. And last होता है tight. That is synthesis of ATP. पहले रिलीज हुआ, एडीपी एंड पीआई बाइंड किया अंदर, और अंदर रिलीज हुआ, अंदर सिंथेसिस हुआ. ठीक है, पहले रिलीज हुआ यानी कि ओपन हुआ, उसके बाद लूज हुआ यानी कि दोनों एडीपी एंड पीआई रिएक्ट किया एक दूसरे के साथ और एटीपी तैयार हुआ, और अंदर जो आया सिंथेसिस हुआ यानी कि तब बंद हो गया, मोटर बंद हो गया, काम हो गया, मोटर बंद हो गया. ठीक है, ये यहां तक समझ चुके हो? ओके फाइन. सो एटीपी इज जनरेटेड, राइट? वेयर एटीपी इज जनरेटेड? इन, ये क्या है? ये चीज क्या है? पूरा लास्ट डे से सिखा रहा हूं, चीज क्या है? इन इलेक्ट्रॉन ट्रांसपोर्ट चेन. हाँ, माइटोकॉन्ड्रिया इज राइट. So ATP is generated in electron transport chain. So when ATP is generated in electron transport chain, that is called oxidative phosphorylation. यानी कि इलेक्ट्रॉन ट्रांसपोर्ट चेन में ऑक्सीडेशन होता है, एंड PI ADP के साथ, PI is inorganic phosphate, PI inorganic phosphate, ये ऐड होता है, कैपिटल P स्मॉल I. ओके, ये ऐड होता है, फॉस्फोराइलेशन होता है. So that is called oxidative phosphorylation. ठीक है. अभी similarly, माने on the other hand, when ATP is generated without ETC, हो सकता है ना, from high energy compounds, हो सकता है ना. When ATP is generated from high energy compounds without involvement of ETC, it is known as substrate level phosphorylation. It is known as substrate level phosphorylation. ये लिख लो. This is the difference which is being asked. What is oxidative phosphorylation? What is substrate level phosphorylation? One, ATP synthesis from ETC. दूसरा, ATP synthesis from high energy compounds. Okay? Is it clear? क्या रे, कोई रॉकेट साइंस नहीं है भाई? क्लियर है ना? अगर नहीं है तो बोल, कहां कॉन्फ्यूजन है? बोलो, कोई प्रॉब्लम नहीं है, बोल. सीखने के लिए आए हो तुम लोग, बोलो कहां कॉन्फ्यूजन है. जोड़े बोल, কোনটা রিপিট করব বল? দেখ, ডেফিনেশন বইতে পেয়ে যাবি, ঠিক? জিস্ট বোঝো. आगे from last day what you are learning, ETC, electron transport chain, where electrons are transported towards final acceptor, that is oxygen. So there is involvement of oxygen, right? half O2 বলেছিলাম. So there is involvement of oxygen, right? So thing is oxidative है. Now ATP is generated. अगर ये कॉम्प्लेक्स 5 नहीं रहता है, एटीपी सिंथेस कॉम्प्लेक्स बोला जाता है इसको. दिस इज कॉम्प्लेक्स 5 इज नोन एज एटीपी सिंथेस कॉम्प्लेक्स. तो एटीपी सिंथेस कॉम्प्लेक्स अगर नहीं रहता है तो एटीपी जनरेट होगा क्या? नहीं. सिंथेसिस होगा? नहीं होगा ना. तो एटीपी अगर सिंथेसिस कहां से होता है? एडीपी से होता है. एडीपी कहां से आता है? पीआई इनऑर्गेनिक फॉस्फेट लगने के बाद ही आता है. तो फॉस्फोराइलेशन हो रहा है कि नहीं? सो जो एटीपी ETC के माध्यम से जेनरेट हो रहा है, उसको बोला जाता है ऑक्सीडेटिव फॉस्फोराइलेशन। और जो एटीपी, सपोज तू बहुत नेगेटिव है, ठीक है, तू नेगेटिविटी किसी और को दे रही है, सो यू आर हाई एनर्जी कंपाउंड, ओके, एंड यू आर फॉस्फोराइलेटिंग योर फ्रेंड एट योर लेवल। यानी कि जो हाई एनर्जी कंपाउंड, जो सबस्ट्रेट बहुत नेगेटिव है, तो उससे अगर एटीपी जनरेट होता है तो it is being generated from that high energy compound. That means that ATP is coming, that phosphorylation is occurring at substrate level, not at oxidative level. आया समझ में अभी? Not at ETC level. Example सीखोगे, 1,3-bis-phosphoglycerate to 3-phosphoglycerate. It's a substrate level phosphorylation. Phosphoenol pyruvate to pyruvate. It's a, सब सीखोगे, ग्लाइकोलिसिस में सब सीखोगे, डोंट वरी, इट्स अ सबस्ट्रेट लेवल फॉस्फोराइलेशन। क्रेब साइकिल में एक स्टेप है जो सीखोगे फ्रॉम सक्सिनेट ऑनवर्ड्स, तो इट्स अ सबस्ट्रेट लेवल फॉस्फोराइलेशन, ठीक है, डोंट वरी। नाउ अच्छा, आप लोग सीखना चाहते हो व्हाट आर हाई एनर्जी कंपाउंड्स? चाहते हो सीखना? चलो सिखा देते हैं। दिस आर पोस्ट ग्रेजुएट लेवल क्वेश्चन, ओके। सो एमसीक्यू आता है, तो अगर सीखना है तो सीख लो। तो इनहिबिटर्स और अनकपलर्स सिखाएंगे इसके बाद, डोंट वरी, वी विल कवर। अभी क्लास 10 मिनट लेट भी हो, चलेगा? तो चलो चलेगा। तो लिखो हाई एनर्जी कंपाउंड्स, लिखो हाई एनर्जी कंपाउंड्स। यू विल नॉट फाइंड इन एनी बुक इन दिस कॉन्साइज मैनर। Compounds that have high negative free energy, compounds that have high negative free energy are called high energy compounds. Means -7 kilocalorie, माने equal to or more than -7 kilocalorie. That means -7 kilocalorie per mole or more is generated on hydrolysis. यानी कि जो कंपाउंड टूटने के बाद -7 किलोकैलोरी या फिर उससे भी नेगेटिव एनर्जी प्रोड्यूस करता है, उसे बोला जाता है हाई एनर्जी कंपाउंड। फॉर एग्जाम्पल, अभी बोला मैंने पीईपी, फॉस्फेनॉल पाइरुवेट। दूसरा है क्रियाटिन फॉस्फेट, क्रियाटिनिन नहीं, क्रियाटिन फॉस्फेट। तीसरा है वही एटीपी जीटीपी, वही पाइरोफॉस्फेट्स, इसको बोला जाता है। ये तो पता है ना, एटीपी जीटीपी, इसको पाइरोफॉस्फेट्स बोला जाता है, पता है? तो अगर नहीं तो बोल। Haven't you read enzymes? Have you completed? Okay, you haven't read. Okay, fine. So pyrophosphates like ATP, GTP, CTP, etc. And last is acyl phosphates like carbamoyl phosphate, carbamoyl, CARBAMOYL, carbamoyl phosphate. और एक आया था क्वेश्चन, which is a high energy compound, पीजी में आता, तुम लोगों का नीट पीजी में आया था। तो नेक्स्ट में भी आ सकता है। एसाइल कोए उसको बोला जाता है एसाइल थायोएस्टर्स, एसाइल थायोएस्टर्स लाइक एसाइल कोए, एसाइल थायोएस्टर्स लाइक एसाइल कोए। अभी एसाइल कोए के अंदर सक्सिनल कोए भी आता है, ठीक है, इसके अंदर सक्सिनल कोए भी आता है। एसाइल थायोएस्टर्स लाइक एसाइल कोए, सक्सिनल कोए एक्सेट्रा कर दो। This is out of context, okay? These are not to be taught in LT, in lecture classes, but I included that just for your knowledge, ताकि कोई अगर पूछे, बहुत अच्छा आंसर दे रहे हो तो आप लोगों को पूछा जाएगा। Name some high energy compounds and what are high energy compounds? अभी आया समझ में कहाँ से? अभी तुम लोगों को लग रहा है कि सर क्या सिखाया, ये फालतू का नाम सिखाया। It is true. अगर मैं भी तुम लोगों की जगह होता और जब मुझे अगर मुझे भी बोला जाता तो मैं भी आई वुड हैव कर्स्ड द टीचर, बिलीव मी, ओके, बट यू विल लर्न एवरी सिंगल थिंग इन योर मेटाबॉलिज्म क्लासेस, ओके। नाउ चलो, नाउ कमिंग अगेन बैक टू ईटीसी, सो वी विल नाउ स्टार्ट विद द इनहिबिटर्स एंड अनकपलर्स, ओके। अब तुम लोगों का वन लाइनर आता है ना क्वेश्चन में, वेस्ट बंगाल में आता है ना वन लाइनर, एमसीक्यू आता है ना, माने रिटन थ्योरी में आता है, तो वन लाइनर्स, फिल इन द ब्लैंक्स आता है। तो दिस इज द वन क्वेश्चन यू विल गेट दिस फ्रॉम इनहिबिटर्स एंड अनकपलर्स, दिस वन फिल इन द ब्लैंक्स और वन लाइनर यू विल बी गेटिंग इन योर नेक्स्ट एग्जाम, ओके, फर्स्ट इंटरनल लिखो। सो इनहिबिटर्स, तो 4 कॉम्प्लेक्सेस हम लोगों ने सीखा था, तो 4 कॉम्प्लेक्सेस का इनहिबिटर्स सीखेंगे, ठीक है। हर एक का 3 से 4 एग्जांपल बोलूंगा, बहुत है, 3 से 4 एग्जांपल बोलूंगा, रैपिड अप, ठीक है। टफ लगेगा, मुझे रोक रोक के बोलना पड़ेगा, सो प्लीज राइट इट डाउन। फर्स्ट इज पियरसिडिन, पियरसिडिन, PIERCIDINE, पियरसिडिन। अभी बार्बिचुरेट्स का नाम सुना है, एंटी डिप्रेशन में जो दिया जाता है, हाँ, तो लिखो सेकंड है बार्बिचुरेट्स, ब्रैकेट में लिख ले एंटी डिप्रेशन। अभी जूलॉजी किस को पसंद था क्लास 12 में? पसंद था तुझे? चल बोल, फिश पॉइजन का नाम क्या है? रोटेनॉन, राइट, वेरी गुड, यू हैव रेड एंड कम, वेरी गुड। तो रोटेनॉन इज फिश पॉइजन। फोर्थ इज गुआनिडिन, गुआनिडिन। अच्छा, कॉम्प्लेक्स 2 में आ जाते हैं, गुआनिडिन, GUANIDINE, कॉम्प्लेक्स 2 में आ जाते हैं। कॉम्प्लेक्स 2 इज कार्बोक्सिन, CARBOXIN, कार्बोक्सिन। दूसरा है this thing you will also learn in metabolism, okay, malonate, you will, अच्छा, you have read inhibitors, right, एंजाइम में इनहिबिटर सिखाया ना, तो बोलो कुछ कॉम्पिटिटिव इनहिबिटर्स का नाम बोलो। पार्डन और कॉम्पिटिटिव इनहिबिटर गाउट में जो सीखा था, सुइसाइड इनहिबिशन, चलो, दिस इज द कॉम्पिटिटिव इनहिबिटर, मेलोनेट इज अ कॉम्पिटिटिव इनहिबिटर। थर्ड लास्ट इज TTFA, मतलब TTFA याद रख, TTFA लिखने से काफी है। TTFA अगर लिखना चाहते हो तो लिख लो, ट्राइएनोइल ट्राइफ्लोरोएसीटोन, ट्राइएनोइल ट्राइफ्लोरोएसीटोन, TTFA, ट्राइएनोइल ट्राइफ्लोरोएसीटोन, ट्राइएनोइल ट्राइफ्लोरोएसीटोन। अच्छा, आ जाते हैं कॉम्प्लेक्स 3 में, ठीक है। जितना आगे जाएगा उतना इजी होगा। Why are you so excited? Any problem? चलो, फर्स्ट इज दिस BAL, कैपिटल। BAL, British anti-Lewisite, British anti-Lewisite. Second is antimycin, antimycin, MYCIN, antimycin. एंटीमाइसिन बहुत टफ है, मुझे पता है. इट टुक मी years टू रिमेंबर, years, I mean it. This one is a really tough thing. It took me years to remember. Please, you are young brains, so please try to remember, okay? Because these are very important, okay? अच्छा, एंटीमाइसिन बोला. तीसरा है फेनफॉर्मिन, PHENFORMIN, फेनफॉर्मिन. Complex 4 is very easy. Complex 4 is very easy. It's CO, carbon monoxide. Cyanide. Hydrogen sulfide. ये तीनों याद रखो. ये होगा, चारों कॉम्प्लेक्स का हो गया ना. अभी कॉम्प्लेक्स 5 का क्या हुआ, यानी कि ऑक्सीडेटिव फॉस्फोराइलेशन के इनहिबिटर्स. ये चारों कॉम्प्लेक्स यानी कि ETC का इनहिबिटर्स हो गया, चारों कॉम्प्लेक्स हो गया. एनी प्रॉब्लम? बोलो, बोल सकते हो. बहुत बोर्ड लग रहा है ना. AC इज ऑन. आ जाओ, इधर आ जा, इधर आ जा, दोनों इधर आ जा. बी कंफर्टेबल. आ जाओ. बी क्विक, बी क्विक, बी क्विक. आई हैव ऑल डे बट यू डोंट. So, inhibitors of oxidative phosphorylation. Number 1, oligomycin. Number 1, oligomycin. वो जो F0 सब यूनिट सीखा था ना ATP सिंथेस कॉम्प्लेक्स का, उसको इनहिबिट करता है ओलिगोमाइसिन. ओलिगोमाइसिन. सेकेंड पॉइंट क्या था, ADP एंड PI जो ट्रांसलोकेट होता है उसको इनहिबिट करता है, जो उसका नाम है एट्रैक्टिलोमाइड. ATRACTILO, एट्रैक्टिलोसाइड, टिलोमाइड नहीं, एट्रैक्टिलोसाइड, CIDE, एट्रैक्टिलोसाइड. वो जो इनहिबिशन ऑफ ट्रांसलोकेशन, इट इज माने इट हेल्प्स इन इनहिबिशन ऑफ ट्रांसलोकेशन ऑफ ADP एंड PI. 3 नंबर है वैलिनोमाइसिन. वैलिनोमाइसिन what does it do? It disrupts the proton gradient across the mitochondrial membrane. It disrupts the proton gradient. अच्छा, what is a valinomycin? Do you have an idea? छोड़ो, ये बाद में देखा जाएगा, ठीक है. चलो, इनहिबिटर खत्म. Enough of torture, ठीक है. Enough of torture. Now coming to uncouplers. Last thing, I promise. Now coming to uncouplers. अच्छा, what are uncouplers? ये मैकेनिज्म तो जानना जरूरी है ना, तो इट विल बिकम इजी, ठीक है. तो लिखो मैकेनिज्म ऑफ uncouplers. अभी देख, अगर ये दिस प्रोटॉन्स कैन नॉट कम बैक, राइट? व्हाई? कोई वाई उधर से? दिस प्रोटॉन्स आर नॉट. अगर ATP सिंथेस कॉम्प्लेक्स नहीं रहता तो प्रोटॉन आ पाता क्या लौट के? नहीं आ पाता ना. क्यों? यस, द मेम्ब्रेन इज नॉट परमिएबल. अरे सिंपल बेसिक पूछ रहा हूं, नहीं समझ में आ रहा है? आपके पीछे बोल रहा हूं. अब चारों बेंच तो ठीक हो, चलो बाकी सब तो सो चुका है ना। तो मेम्ब्रेन इम्परमेबल कैसे आएगा? अगर मेम्ब्रेन इम्परमेबल ना होता तो क्या प्रोटॉन ऐसे एक्यूमुलेट होता क्या? क्या प्रोटॉन ग्रेडियंट होता क्या? नहीं होता ना। अगर प्रोटॉन ग्रेडियंट नहीं होता तो एटीपी जनरेट होता क्या? नहीं होता ना। तो uncouplers do that thing. It makes the inner mitochondrial membrane permeable. That means it increases permeability of the inner mitochondrial membrane. यही है mechanism, लिख ले। It increases permeability of inner mitochondrial membrane. यानी कि प्रोटॉन ग्रेडियंट हो ही नहीं रहा है, ऊपर जमा नहीं हो रहा है H प्लस, थोड़ा बढ़ रहा है, परमेबिलिटी बढ़ रहा है, अंदर आ रहा है, बढ़ रहा है, परमेबिलिटी बढ़ रहा है, अंदर आ रहा है, तो कैसे होगा एटीपी जनरेट, है ना। तो इट डीलिंक्स द ऑक्सीडेटिव फॉस्फोराइलेशन फ्रॉम ईटीसी, सो इट डीलिंक्स दिस फ्रॉम दिस, है ना। पहले दिन जो सिखाया था, आज जो सिखाया है वो लिंक्ड है ना, लिंक तो है ना। पहले दिन इलेक्ट्रॉन ट्रांसपोर्ट होके आया, इसीलिए प्रोटॉन ऊपर जमा हुआ, क्यों? क्योंकि अंदर नहीं आ पा रहा है। अभी आज वो जो प्रोटॉन्स लास्ट डे जमा किया था वो तो आज तक 7 दिनों में बहुत जम चुका है ना। 7 दिन, आई मीन टू से, आई एम ट्राइंग टू मेक यू अंडरस्टैंड। अगर 7 दिन तक नहीं आएगा तुम लोग जिंदा नहीं रहोगे। एनीवेज, तो अभी बहुत जम चुका है, बहुत टाइम हो चुका है, आना तो है ना उसको अंदर, एटीपी तो जनरेट होना है ना। इट्स ऑकरिंग एवरी मोमेंट फ्रॉम द मोमेंट यू आर बॉर्न, ओके। सो एटीपी अगर एटीपी जनरेट होगा कैसे? अगर परमेबिलिटी हो गया ज्यादा, ठीक है। अभी कुछ चीजें तो होगा ना, कुछ ड्रग्स तो होगा ना, कुछ एजेंट्स तो होगा ना। वो केमिकल भी हो सकता है, वो शरीर के अंदर रहने वाली चीज भी हो सकता है। अगर शरीर के अंदर रहने वाली चीज है उसको क्या बोला जाता है? फिजियोलॉजिकल। दूसरा जो बाहर से आता है उसको क्या बोला जाता है? केमिकल, ठीक है। सो ये डीलिंग किया कॉम्प्लेक्स 5 से, यानी कि ऑक्सीडेटिव फॉस्फोरिलेशन और ईटीसी को डीलिंग कर रहा है अनकपलर, एंड देयर विल बी नो प्रोडक्शन ऑफ एनर्जी। बट अभी इंजन मेल फंक्शन करेगा तो हीट तो प्रोड्यूस होगा ना, बट देयर विल बी प्रोडक्शन ऑफ हीट विदाउट एटीपी। सो उधर लिखा डीलिंग्स ऑक्सीडेटिव फॉस्फोरिलेशन फ्रॉम ईटीसी, उसके अंदर एरो देके लिख लो देयर विल बी प्रोडक्शन ऑफ हीट, ब्रैकेट में नो एटीपी। आया तो समझ में? ठीक से बोल, आया ना? पीछे वाले हाँ या ना? बाद में गाली से अलावा कुछ नहीं मिलेगा, इसलिए बोल दे हाँ या ना। आया समझ में सबको? कैन आई आस्क एनीवन ओवर हियर हुज हार्ट इज पाउंडिंग? चलो कोई बात नहीं, नहीं पूछूंगा। तो अभी उसको कैटेगराइज करो। अनकपलर्स कैन बी क्लासिफाइड इनटू फिजियोलॉजिकल एंड केमिकल। तो फिजियोलॉजिकल अनकपलर का नाम बोलो। फिजियोलॉजिकल मतलब शरीर में ही है ना। तो पहला है थायरॉक्सिन, पहला है थायरॉक्सिन। इसका नाम तो पता ही होगा सबको, एवरीवन? हाँ, तो you are severely low on energy. चलो, second is long chain free fatty acid, long chain free fatty acid. Third is unconjugated bilirubin, unconjugated bilirubin. और fourth is unconjugated bilirubin, and fourth is thermogenin. Thermogenin, that is it is a thing which is present in brown fat, okay. ब्रैकेट में लिख सकता है इट इज प्रेजेंट इन ब्राउन फैट। वो क्या करता है ना, वो कैसे बताऊं, हाइबरनेटिंग एनिमल्स होता है ना, उसमें रहता है ब्राउन फैट, वो हीट प्रिजर्व करता है उसमें, ठीक है। अभी केमिकल अनकपलर्स लिखो, केमिकल अनकपलर्स। अच्छा, कैसे याद रखना है, मुझे देख के याद रखना। मेरा गाइड ऐसे बोलता था, ठीक है। सो ही वॉज फ्रॉम गुजरात, ही वॉज ए वेरी लीन एंड थिन, मोस्ट ऑफ द गुजराती पीपल आर वेरी लीन एंड थिन, ओके। जो होता है मेरी तरह होता है। सो ही यूज्ड टू टेल मी, always remember him and tell these examples. I used to ask him why. The day I passed my postgraduate, he told me the secret. Okay, he was he was a very senior person. I should not tell. He used to tell me, remember yourself. थायराइड आया, उसके बाद लीवर आया, उसके बाद पेट आया, देख सब कुछ है। देखो पहले क्या लिखा है, थायरॉक्सिन लिखा, उसके बाद क्या लिखा, अनकॉन्जुगेटेड बिलीरुबिन, उसके बाद क्या लिखा, फ्री फैटी एसिड, फैट है ना, और उसके बाद ब्राउन फैट, यानी कि मुझे ठंड कम लगता है इसलिए बोला था, याद रहेगा अभी। चलो नेक्स्ट इज लास्ट, केमिकल अनकपलर्स। केमिकल अनकपलर्स, टू फॉर डीएनपी, डीएनपी सब कैपिटल, 2,4 डीएनपी, 2,4 डीएनसी। लिखो, बोलता हूं क्या चीज है। डाइनाइट्रोफेनॉल, डाइनाइट्रोक्रेसॉल, डाइनाइट्रोफेनॉल, डाइनाइट्रोक्रेसॉल। सो रिमेंबर 2,4 डीएनपी, फुल मार्क्स। अगर याद रख पाओ डाइनाइट्रोफेनॉल, एक्सेलेंट। एक की जगह 2 नहीं मिलेगा एक नंबर क्वेश्चन में, पर वाइवा में लाभ मिलेगा, ठीक है। एंड थर्ड इज एफसीसीपी, एफसीसीपी कैल्शियम, Ca++, कैल्शियम आयन। आप लोगों को पता है कि कभी सुना होगा, अभी उतना चलता नहीं है, पर गांव के साइड में फिर भी चलता है, सर दर्द हुआ एस्पिरिन ले लिया, है ना, पता है। कोई RUMPs के पास जाता है, सर दर्द होता है, एस्पिरिन दे देता है। ओवर इनटेक ऑफ एस्पिरिन causes, acts as a chemical uncoupler. So over intake of aspirin. Okay, there is another question coming nowadays which I will not teach you as a question. I should, but I will not. I have already taught. What are, 2 नंबर का क्वेश्चन आता है, 2 और 3 नंबर का, what are the enzymes of oxidative phosphorylation, यानी कि ETC plus oxidative phosphorylation, क्या क्या enzymes लगता है। It can be oxidoreductase, which is categorized into oxidase, peroxidase, etc., etc. These things you have to read yourself. I have already made you, I did make you learn what enzymes are required. Last day बोला था ना, what enzymes are required in the complexes, oxidoreductase, oxidase, reductase, peroxidase, सब बोला था देख। तो those are the enzymes, but you have to prepare that as a question, ठीक है। अगर फिर भी अरेंज नहीं हो पा रहा है, नेक्स्ट वीक बोलना, that is your deadline. After that I will not make you learn. Okay, चलो, have a great evening.